celebrities, astronauts.
In critical care medicine, trust isn't given, it's earned. Across every shift, every patient, every decision, certification stands as the mark of commitment. Welcome to Validated, the official podcast of the International Board of Specialty Certification.
Hey everybody, welcome to episode 2 of Validated, the official podcast of the IBSC. My name is Mike Verkest, joined again with John Clark.
Hey there, everybody.
Yeah, we'd like to welcome you guys to episode 2. Episode 1 was really fun. Appreciate it. It's been some great feedback, lots of great comments, people digging it. We got some subscribers. And so just as a reminder, head on over to wherever you listen. And then we also have not a Facebook page. We were just talking about Facebook, which you'll hear about that in a minute, but the YouTube channel. Go check out the YouTube channel. So John, how's it going today? What's new with you, buddy?
Everything's good. It's, we're busy. The survey went out and it's a lot of work, but it's kind of rewarding to see it out here and moving along. So that's good, but yeah, all is good.
Yeah, well, that is good. So let's sort of reframe here. So episode 1, we talked about sort of the idea of the hospital-based paramedic and we heard from some people that are actually working in those roles or educating people that are going to be in those roles. And we heard their story about this is not a new thing. We've been doing this for a while. And the organizations come to IBSC and say, hey, we have this resource. We'd love to have a standard, right, for what that means. And so that was what episode 1 was all about. And again, part of that was the group that came to Dallas and did the task analysis. And we're going to build off that today in the next sort of line of things to do in this process. And that's talk about the survey, right?
Yeah. And I think it reinforces some of the things we caught in episode 1, but just in general about the way that the IBSC does things is that, I think there's the impression by many people that, it's written on the back of a napkin and it's just kind of it's some sort of fake kind of thing that we put together. But it's a very rigorous process. And so this step that we're involved in now, that survey, is the opportunity to kind of get everybody's opinion. And I think that's what's really important. We talked a lot about the guys that came to Dallas to do the JTA. They had some ideas and they had their own perspective. And, we had collected job descriptions and things from hospitals all over the place and put that together. And so we came up with a survey out of that. So we think, hey, this seems like a pretty reasonable approach to what the domain of knowledge is that the hospital-based paramedic is going to have to, face. But now that the survey's out, this is the community's opportunity to say, we don't do that and say 0, but, oh man, you guys forgot about this. This needs to be included in the exam. And so this is where we really fine tune it. And I think that's what's really interesting to see the feedback and the comments that come in. How close were the subject matter experts? That was a group of 12 people. They did the best job they could with, their systems. So now we really get to see what the entire community has to do. So if you have something to say, the survey is the way to say it.
Yeah. So, clearly you want folks that are working in that role in a hospital, right? And whatever that role may be, it might be in the ED, it might be in the ICU, the cath lab, wherever it is they're working. And those are the people you guys want filling out this survey, right?
Right. Absolutely. Certainly there will be some people that work on the fringe. One thing that we talk about is, a lot of flight crews will end up working, in some hospital units. But they're never assigned a patient or rarely assigned a patient because they have to be able to cut loose and go quickly. But still, that kind of input is important as well. Certainly it has to be somewhat in your domain that you understand the hospital role. So if you're a new 911 paramedic, have never really worked in an ICU, probably the survey isn't the right tool for you to look at. But we want to try to get the best representation across the country that we can with as many opinions as we can.
Yeah, that's awesome. I've had a number of people reach out to me because, I shared the initial first episode, shared the survey, had lots of great feedback, and it's kind of funny, there's like these two different worlds. We might have mentioned a little bit in the first episode where, there's a real core group of folks that are just all about it. Any opportunity we can give paramedics to sort of advance in their career, work in a different line of our business that maybe isn't normal to you or me, but that's their world. Like they were all about that. And then, to your point that we were talking pre-show, that there's also another group that's very staunch about this is a money grab and this is another, merit badge and all these little things. So how do you respond to that as the, chief operating officer of the IBSC?
I think what's really, really important is that it's the idea that we're trying to make the practice better. And whether that's from, improving the opportunities that paramedics have to work in different venues. But I think the big thing here with the hospital paramedic that people don't really recognize is that nearly half of the states, EMS stops regulating paramedic practice when they hit the hospital door. And from a liability perspective for these healthcare systems that are employing paramedics, it's a huge issue. Um, one of the things that the SME group talked about, and that I think is very important in understanding this role that is here, is that paramedics have been working forever in emergency departments. That's kind of the role. I mean, when I first started my EMS career, I worked a second job in a children's trauma center as a tech in the ER. And my primary role was pushing people to X-ray and
Picking up
holding
beds
them while they
and
started
yeah,
IVs, things like that.
yeah.
But now you look at what paramedics are doing, and we have paramedics working in cath labs that are doing nearly everything. We have paramedics that are working in very autonomous roles in urgent cares and things like that. And you say, well, I'm a paramedic, but if you're sued, let's say, if there's a bad patient outcome, and the defense attorney is throwing you across the courtroom saying, so exactly why are you certified to work in this setting? And you're like, well, I'm a paramedic. That's not going to go very far with a jury. However, if you say, well, I have specialized training and I passed a third party credentialing exam in board certification as a hospital paramedic, that's a leg you can stand on. And I think that's one of the things that people just don't think about. I think the other thing that's really interesting in the group that we talked with, and kind of the idea behind this, is that we're not trying to take nurses' jobs. We're not trying to, do anything different. We're not in it to, oh, this will get paramedics more money. That's not it. What we're trying to do is create a certification level that allows a hospital system to say, I know what this person does. I know how they fit into our structure. And as part of a collaborative care team, that's what they're going to do. And, it's not an alien concept, Mike. This is the thing that I find so interesting is if you look universally across the US mostly, but, the optimal flight crew is a nurse paramedic.
Yeah. Yeah.
There's a reason for that. They bring a different skill set to the table. They work well together. It's a great mesh of that healthcare side. And that's what this will do. Now you're going to have hospital administrators that say, hey, I can use paramedics in this role. They're credentialed, they're certified, and it gives them a great opportunity to expand. Just the other thing that I think is really important, and for those of us that are getting older, I don't know, Mike, if you've noticed that, I've had a couple of birthdays.
Yeah.
I think since the last episode dropped, I've probably gotten
It seems
older.
like it. Feels like it.
Yeah. But when we did community paramedic, that was at the behest of people that were putting together the community paramedic curriculum. Some of the people at NHTSA that came to us and said, hey, look, there's no real standard for this. What's this going to look like? And we were able to kind of help forge that standard that set up what community paramedicine is today. But if you look at that role, these are paramedics that have an incredible amount of experience. Their clinical acumen is amazing. And they're getting older and they don't want to work a truck and they don't want to be humping a stretcher at 3:00 in the morning. This is a great opportunity to continue your career. And I think hospital paramedics can be exactly the same thing. These are going to be high-end clinicians that are looking for a different role.
Yeah. Yeah, absolutely. I mean, one of the discussions I had when we were in Dallas there for the JTA was with somebody. I don't remember exactly who it was. By the way, we're still going to release, we got seven like 5 or 8 minute videos of like the full interviews with those folks that is going to be coming out soon. So keep an eye out for those videos where you can get to learn to meet some of these folks that are actually doing this job. But yeah, there's also a subgroup of people that get into EMS because they are 100% using EMS as a stepping stone, right? So, for example, and this happened to me a ton when I was working in the Portland area. It was that, we'd have EMTs and paramedics come through. They want to get into med school. They want to go to, PA school, whatever it happens to be. There's something more that they want to do. And working an ambulance was kind of the means to an end because they wanted some experience taking care of patients. Well, in my mind, I was thinking, wow, I mean, imagine that same person now sort of getting their paramedic and then just going straight into the hospital, which is where they want to be ultimately anyway, probably. What a cool thing for them. They're going to miss out on the cool stuff we do in the field, but they're going to get a really great experience and get that same amount of like hands-on stuff that they would normally get working an ambulance, and they're going to be in their kind of environment. So I thought that was pretty cool too.
Yeah, and I think everybody's career path is different. And we hear it a lot about, well, nurses get paid more money. Well, they also have a very strong nursing lobby. I mean, there's a lot of reasons that they do.
For sure.
But I think that, we lose a lot of really, really good clinicians, a lot of good leaders that came up, as you were saying, in the paramedic world. And then, maybe for financial reasons only or whatever, but, they went to nursing school because they saw that as their pathway.
Yeah.
This is a pathway now.
Yeah.
And I think that's really important. And that'll allow us to keep, really strong clinical leaders in the paramedic profession in this additional expanded role. And I think that's really interesting.
Yeah. All right. I'm going to put you on the spot for one last thing before we're going to pull up the survey and just take a peek, and we're just going to kind of run through it.
All right, let's do it.
But here you go. So here's a comment I saw it with community paramedic. I saw it with wilderness. And now we're seeing it again here. And that is you, John Clark. You're just a money grabber. You just want people's money. What?
Yeah, that is not really the way it works. The interesting thing about this, if you look at the IBSC, just from that perspective, is we have a volunteer board of directors. There's a couple of paid people that keep the lights on, but in general, this is a commitment of people that get no reimbursement whatsoever. So to say it's a money grab, I think, is a little unrealistic. It is expensive, and we do understand that, and especially for people that hold multiple certs.
Yeah.
That's a commitment. Of course, there are some great ways for you as the IBSC certified flight paramedic, critical care paramedic, wilderness paramedic, to kind of mitigate some of that cost is getting involved. Our item writers that work, a ton to get good items and work endlessly to get the exams to look good. They don't have to pay to recertify because that's part of their perk of being an item writer. So, if it's really pressing like that, hey, get involved. There's a ton of things to do on the board, in the committees, and however you do, and reach out to us and find something. But no, I think that is a legitimate concern. I think that part of the way that we've always done this is, we've only increased the price once in the last 25 years. We try to maintain that and make sure that it is competitive. And frankly, if you are a member of any of your professional organizations, whether it's ICAP, SOMA, you get $100 discount off the exam. And we do that to encourage you to be involved in your professional community. And we think that's important too. So I don't think it's a money grab. I think it's a good opportunity to improve the quality of care and to, advance the profession in a way that makes sense.
Yeah. While I'm thinking about it, I had somebody reach out to me and ask me how they can get involved in item writing. And I know in the first episode, you told me there's an email they can send. What was the email again?
If you want to get involved, if you have any questions, if you want to have any of us give you a call, it's help@ibsc.org.
Perfect. Perfect. And we'll put that in the show notes and it'll be on the screen as well. But I knew there were some. All right. Let's talk a little bit of survey. Let me pull up the survey here real quick. And I know you've got it up on your end, but let's talk a little bit about it. So if you haven't seen the survey, there is a link to it in the show notes, whether you're listening to the podcast or you're watching it on YouTube or you're seeing it on social media. It's been shared a ton on social media, by the way. And you want to take this, then that's how you're going to get to it. But tell us a little bit about, I know we kind of mentioned it a little bit, but it looks like it's going to take someone 20, 25 minutes to fill the sucker out. This is the next step, like we talked about. We had the job task analysis from the information you gathered from those professionals. Boom, this gets developed. And I'm assuming this isn't John and Graham sitting in the corner one night making up a survey. I'm guessing this is probably like a legit thing that's happening here. So tell us a little bit about that.
Yeah, so this is the direct work of the group that was in Dallas that created this from the job task analysis. So as we talked about in episode 1, the job task analysis kind of went through and said, well, what do we think hospital paramedics do? And, what are the tasks that are there and what's their professional responsibilities? So we take all of that information and we create this survey. And the survey is divided into 3 sections. The first is background information. So really we want to be able to quantify who the respondent is. And because when the psychometricians take a look at this, they want to make sure that the data is valid. So, we can't have everybody from Texas and nobody from North Carolina. Yeah. So we would try to get a very large regional or national perspective on this. And there's other things about, your level of education, just things that will help the psychometrician kind of figure out, how valid is the survey information that comes in. Then the second part is the task ratings. This is probably the most tedious part of it. It's all Likert scales, so it's a 0 to 4 rating. There's 52 of them with 2 scales, one for frequency and one for criticality. So you're gonna click a button 104 times. So it does take a little bit of time to do that.
Does it work good on mobile devices?
It does work on mobile. Yeah, it's designed to go across any platform.
All right, good. That makes
so the one thing that is problematic is it will allow you to leave and come back, but it's not great about it. So if you can get through it in one setting, we prefer that. And not only that, I think mentally, as you get into the rhythm of answering the questions, if you come back a day or two later, you kind of forgot, what was that other one that I just did? So we like you to do it in one sitting.
So results may vary if you decide to come back to it. Just do it all at once.
Exactly. Yeah. And then the last section is just some open-ended items. That's where you have an opportunity to provide some comments, add some things that, you think should be in there that weren't covered in there. And that's how it's set up, in those 3 sections. But the one thing I want to focus on when we look at the survey itself is that when you get to the criticality and frequency, that's what's important, in the way that you do it. So you have to rate each task on the 2 different scales. And for the frequency, what we're asking is, as a paramedic working in a hospital, how often do you perform this task? And, I do it every day. It's a part of my routine practice. Or, wow, I never do that. Or I do it once a month, or, maybe every now and then, every couple of times a quarter. So that way we can rate how often are we exposed to this particular task. So what will come out of that in the survey results then, if the JTA subject matter experts put something on there that said, we think this is super important, and it comes back that everybody that took the survey said its value is 0, I do not perform this task, then that will not be on the exam.
Yeah.
So that's why frequency. And then criticality is the same thing. There may be things that we do all the time, but they're not very critical. Like, checking a patient's armband, as an example. That's not one of the tasks, but I do that very frequently. But really, it's minimally important. I mean, I know the patient. I've been talking to them. They've been in my care for the entire time. I know that Mr. Smith is in room 8. Yeah, sure, we have to go through from the Joint Commission perspective. We do have to, ensure we know who the patient is. But it's things like that. Whereas you look at other things like, Is it important that I know how to insert a chest tube? Yes, that's critically important. I need to do that correctly or a bad outcome will happen. But how often do I do it? I do it very infrequently. So that's kind of the things that we're asking those two questions. How often you do it, and then how critical is it that it's performed on, on the patient safely. So that's how they all work out between those scales.
Okay.
And then I guess the last part, which I think is worth looking at, is the open-ended questions that we have.
Yeah, let me scroll down there.
Yeah, get there. So, the one thing we're asking is, what tasks do you perform as a hospital paramedic that are not included in the survey? As I said, we had 12 people that worked really hard on this task, but they came from the systems that they came from. They had the experiences that they had. We were tried to widely represent from the systems. We had some rural critical access hospitals that used paramedics across the hospital. We also had some urban settings that, they worked in, just the cath lab or something. So they may not see things that you do. So if there's something you're doing in your role, make a quick note, make sure that we get to see that. And then the other thing that did we mess up the survey? Were there things that you felt were poorly worded, didn't make any sense? It wasn't a distinct task, might have got off tangent somewhere. So if you can identify those by number and say, hey, 52 didn't make any sense. I think what you were trying to say was this. Then it helps us refine that, the psychometrician refine that and know what, the validity again of the survey.
Yeah, makes sense.
One of the things that I think is hard, and it's the next to last question. So your brain's going to be frazzled and you're going to want to close the survey out. But the question is, in your professional opinion, what are the 2 or 3 most important knowledge areas or skills that should be assessed as a hospital paramedic board certification exam? So it may be things that are already in the task list. It may be other things that you think are really, really important that we should ask that question about. So, take a minute and give us 1 or 2 thoughts about that. And then finally, here's the big one. Is we don't know what we're going to call this.
Yeah.
We had a lot of discussion in Dallas about that. We talked a little bit about it in episode 1, but the term hospital paramedic is a placeholder. So give us a suggestion if you have a name that would fit the credential. I mean, one of the ones that was liked a lot in Dallas that we talked about was integrated practice paramedic. And they felt that reflected this idea that we're part of a collaborative healthcare team. It's not a solo kind of thing. So that integrated practice was important, but
It's pretty good. It's got a nice little, ring to it.
Yeah. So if you have some ideas, and then wouldn't it be cool that if you were the one that, gave the name and you can walk around and say I did that.
Yeah, exactly.
So yeah, it'd be kind of fun. But, then of course, after that, we've got to figure out what the artwork's going to look like and how it's going to look different.
It was funny. There's one thing I remember about the trip, because I work up in Fort Worth. And so I popped over and kind of nosed around a little bit during this job task analysis. And there was already a dude trying to draw it out while he was super stoked about it.
Yeah. It's interesting. I had a professor at in my undergrad at GW about in the EMS program there. And one of the things that he said, which I thought was really an interesting perspective, he said, when you say physician, tell me, where do they, what's the environment? And, they'll say emergency department, whatever. Well, nurse, what does a nurse do? But when you say paramedic, everything is tied to a vehicle. Right. I mean, that's the perspective. And I think another interesting linear survey that went on that was it's got to be 10 or 15 years ago. But one of the questions that was asked was, when a red vehicle pulls up in front of your house with flashing lights, who gets out of it? The number one answer that the lay people would say is a paramedic. Not an EMT, not a firefighter, not whatever. It was a paramedic. And, and I think television has a lot to do with that as well,
Probably.
But everybody's a paramedic.
Yeah.
And so when we think about what's a hospital paramedic, are we going to draw a little picture of a hospital? Well, what if you're working in urgent care? What if you're working in an austere setting somewhere? What if you're running a clinic for an NGO? This is great training. And, I think that's one of the things that if you look at the other certifications that the IBSC has done, flight is fairly obvious. The critical care paramedic really came out of the idea that there were ground ambulances doing very similar roles to the flight paramedic, but yet they didn't fly and they didn't feel that that was their community. So they wanted something a little different. I think the medicine in those is probably, some of the discussion, some of the feedback we've received is, well, how is hospital paramedic going to be different than critical care paramedic? Well, I think the medicine's a little different. And I also think really from a healthcare administration perspective is that administrator putting on that hat of a hospital-based paramedic is going to mean more to them than having a critical care paramedic or a flight paramedic come into it. So I think it is an extended body of knowledge that I think will go beyond the critical care world just because of the acuity of the patients we see in the field versus kind of the longer term management that some paramedics are taking care of in the hospital.
Yeah. Yeah, that makes sense. All right. So you're gonna collect. How long is the survey open till?
Survey's open until 31st of May. So we gave the entire month of May to collect data. It's going pretty well. We're getting a lot of feedback, a lot of positive comments. And, one of the problems, and let me speak to the naysayers in the group that might be listening to
All
this,
right, listen up.
is that, a lot of this, and to use an expression, is that, we're preaching to the choir. The people that right now, the number 1, 2, 3, 4, and 5 of the people that did the survey are 100% on board. Oh my God, this is the greatest thing in the world. I can't wait for this to come out. But that doesn't give us valid data. If everybody is, on
everybody
board,
loves it. Yeah.
yeah, that doesn't work. So, this is the opportunity that if you're a naysayer, get in there, do the survey and say, I don't do this. And I think one of the other pieces that I think is important in the survey is that if you don't work in that environment, you may not fully understand this. And I can see if you were working in a very isolated rural community, flying a couple of flights a week or whatever in your role, that's very different than the guy working in an urban trauma center that's seeing, dozens of patients in a single shift. And so really think about that. It's not what you do. It's what everybody across the country does that defines what that body of knowledge will be.
Yeah. Yeah, that makes sense. So it's open till the 31st. So again, link is in the description on the YouTube channel, also in the show notes on the podcast stuff. Then what happens? How long does it take to put all the results together? And then what's the next step after that?
Yeah, really good point. So this is kind of the fun part, to get the data back. So once we get the data back, our psychometrician will start to crunch the numbers and look at all the data. And what we'll do is we'll start to look at patterns and trends that come out in the data. And what we're doing from these job task analysis is this is creating what we call the blueprint, or what is the official name is the detailed content outline. So the DCO, or the blueprint, is what's in the candidate handbook. So if you're taking the flight paramedic exam, you look at the candidate handbook and there's an outline and it says, hey, here's the 5 domains that you're going to know. Here's the subdomains that you need to know for each one. And that's what we're developing here. So when all this data comes back, the psychometrician will go through it. We'll look at what's frequently done, what's infrequently done, what's critical, what's not critical. We'll start to capture that all in, and that will create then the blueprint for the exam. Right now, we believe, in the way the survey is structured, there are 5 domain areas, 5 large domain areas, if you really look at it. And so, the exam will probably track that very similarly. So I'm expecting that there will be 5 domains on the exam, and then under each domain will be these subtasks. And then we take that blueprint and shuffle it off to the item writers.
Yeah.
And that's the next step. So after we get the blueprint set up out of this JTA and out of this survey, then the item writers will get it and they'll start to create items. And then the next step after that is we put together a beta exam. We recruit beta people. Again, if you're interested.
We were talking about that maybe being in the fall sometime.
Yeah, the goal is to get it in the fall. Part of that has to do with timing. EMS Expo AMTC,
Yeah.
they're all the big shows are kind of in the fall. And so it's a good opportunity to get a bunch of people together,
Yeah,
like-minded individuals together,
Yeah.
and be able to take an exam. So
That's cool.
we want to have it ready for the fall. And then the idea is after the beta test is that we expect it to launch in first quarter of 27.
Nice. Well, that's awesome.
Yeah. It's been really abbreviated. This is really a compressed timeline, but the people that are working on it are really, really good at what they're doing. They're really enthusiastic, and it's fantastic.
And if you missed it before, if you're interested in being an item writer or being involved, or you just have questions, you can email help@ibsc.org, and someone will get back to you and give you the scoop. Yeah, I was really talking to somebody about item writing just the other day, and they're like, "Oh, I've never done it before." It's kind of like the same discussion we had, and I'm like, "Oh, they'll train you how to do it. Like, if it's something is interested to, if that's interesting to you, they will like show you how to do it."
Yeah.
So don't be scared.
Yeah, and that's one of the most eye-opening things I think that people come to an item writing meeting, and they all have kind of preconceived notions of what it's about, but they get there and like, oh my God, I had no idea this much went into it.
Yeah.
It goes back to that thing. I think that we write it on the back of a napkin, and that's that's not the way it works. What's really funny, I think one of the best things about item writing, and encourage you all to, jump in and say, hey, I'd like to help with a little bit, and not with just hospital paramedic, but with any of the exams. But what's really funny is the way we do it is, so you'll submit your items, and then we blind them, and we put them up on the big screen in front of everybody that's at the item writing meeting, and you go through it, and someone will, like you, Mike, you'll be like, who wrote this? That's a completely ridiculous question. I can't believe any. Oh, wait a second. That's I wrote that. I'm sorry.
Dang it.
But it's funny. Yeah. They don't even, they get so blinded by, there's so many questions, so many items you're seeing, you just lose track of it. And that's what makes it really good, is that, no one person is writing an item or writing the exam, and it's biased to that level. It's so homogenous. It's really a fantastic process.
On a different note, please tell me we'll do an episode about what in the heck a psychometrician is and what they do and how do they get that job, because that's fascinating to me.
Psychometricians are really, really an interesting breed in and of themselves. It's math, and they're math geeks. And just a story about one of the, we've always been with, well, now we're with Prometric. In the past, we were with a company in Kansas City, and it was really interesting. The psychometrician that was assigned to us was like not far out of school, and was just, was just this total math geek. And he was so excited. And we gave him he did the tactical paramedic, first tactical paramedic job analysis, and we gave him a tactical paramedic jacket.
Oh my gosh.
He was like beside it. He couldn't believe he was like part of the club. It was the coolest thing that had ever happened to him. But it's really interesting because they crunch the numbers, and they love it, and they see it mathematically. And man, it's nothing I don't have that attention span.
Well, maybe we don't need a whole episode on it, but
yeah, maybe half of an episode. What would be really interesting though, Mike, is that maybe when the results do come in, the psychometrician that we're using for this, maybe she can talk about some of the data and how it got there.
Yeah.
That might be worth doing.
That would be awesome. Cool.
Yeah.
All right. Any last thoughts for this episode? It's been a good one.
No, I just think that, fill out the survey, get out there, fill out the survey. And, if you have any comments, it's an 80-20 rule. And if you look at the comments that are out there,
For sure.
Especially in social media where you can say anything you want.
Yes, you can.
Without any repercussions.
Yeah.
And if you're pro hospital paramedic, hey, jump in, make a comment, say, hey, here's the reason. And if you don't understand it, go listen to the podcast, or,
exactly.
Shoot an email to help@ibsc.org, and someone will talk to you, because we're not hiding the ball. It's out there. It's as transparent as can be, and we want everybody's input. So that's the thing I'd like to end with.
So on behalf of John Clark, Mike Verkest, you've been watching and listening to episode 2 of Validated, the official podcast of the IBSC. We will see you on the next episode. You guys take care.
This has been a Blue Pulse Media production.